Dr. Ann Borik, board certified in internal medicine and exercise physiology, chairman of Department of Medicine at Gilbert Hospital, adjunct professor at Midwestern University College of Osteopathic Medicine, black belt, and founder and host of Doc Talk.
It's about caring for your health and well-being.
Taking your calls and giving you clear answers to your health questions. Information you can use for your whole mind and body wellness.
You're not going to want to go away because...
Ask Dr. Ann your questions live at Radio Doc Talk on Facebook, Doc Talk Radio on Twitter, or email Dr. Ann at askann@doctalkradio.com.
And I want to welcome you to the show. This is about caring for your health and well-being. Today we have so much to talk about. I want to focus on live in the desert and learn how to stay healthy. We'll be focusing on topics such as dehydration. What is it? What is the best hydration if you're dehydrated? What is the best fluid replacement? Who's at risk for it? We'll be talking about valley fever and all about the diagnosis, the treatment of valley fever. And finally, we'll be focusing on the sun. The sun in Arizona shines over 300 days in a year. And oftentimes the sun gets a bad rap. There's a risk of skin cancer that we know about. But today I want to talk about the health benefits of the sun. And finally, in our food facts segment, we have a special guest in the studio today, an expert talking about the prickly pear cactus and the nutrition that we get from that. So we have a lot to talk about today. We're broadcasting from the Double Wide Network, and this is just a fantastic studio and a place to be. So welcome and thank you for being with us. Dehydration, what is it? Who's at risk? And what really is the best replacement? Basically dehydration is when we don't replace the fluid that we lose. How do we lose fluid? Well, there are many ways that we lose fluid in the body. Simply by breathing. The nose is designed in such a way that when we breathe, there's certain mechanisms that are in place where the nose tends to humidify the air so that it protects the air for the lung. And by doing that, there's a certain amount of fluid that is lost when we breathe. Every time we breathe, there's a certain amount of fluid that's lost. When, for example, other risk factors, when we lose fluid simply by sweating, perspiration, living in the desert, being out in the heat, we perspire. Not only do we lose fluid, but we lose electrolytes, and that's very, very important. Urination, when we have bowel movements, those kinds of things, we lose fluid. So there's many, many ways to lose fluid in the body. Now, what does that mean? What are the symptoms of dehydration? Well, I got to tell you, for me, the most common symptom that I feel is a headache. When I get dehydrated, it affects me and I get a really bad headache. It can cause nausea. It can cause all kinds of different symptoms. Sometimes people just get irritable, fatigue, sometimes confusion. A lot of times we have decreased urine output when we're dehydrated. So we've got to be very careful because it can lead to things like heat stroke and heat exhaustion, and sometimes it can be even a medical emergency. So the symptoms, there are phases of dehydration that we've got to think about. And I'm sure you've heard of heat exhaustion, heat stroke. What is it? What's the difference? Is there a difference? Well, yeah, there is a difference. Heat exhaustion is when basically you feel very, very fatigued. The body begins to react in such a way that you become tachycardic. The heart rate starts to race. You become nauseated, decreased fluid input, reflecting in decreased urination. And ultimately, if that's untreated, it can lead to heat stroke. And that's a medical emergency. And really, when we talk about fluid replacement, it's important to understand that if we don't get to the hospital and get intravenous replacement of electrolytes in the body, it can ultimately lead to kidney failure and those kinds of things. Now, thirst. I want to just kind of talk about thirst for a moment because I hear so many people say, there's no way I can be dehydrated because I'm not thirsty. And I want you to understand, and if you don't remember anything about our talk and this conversation today, I want you to remember that thirst is not a very good indicator of hydration. In other words, if you feel thirsty, oftentimes it's too late. And that's important to understand because we've got to stay ahead of the game. You've got to keep the tank full, if you will, if you're going to be out in the heat and so forth. And so who's at risk for this, what we call dehydration? really everybody is at risk. Infants, children, adults, seniors, depending on the situation, depending on the environment, really translates into risk. And so just a couple people that I want to bring out in terms of risk. People who, for example, work outside. People who, for example, police officers that are managing the traffic. People who do landscape work. Construction workers. Living in high altitudes also put us for risk for dehydration. Let me explain that, because a lot of times we don't link the two together. But when we're at 8,200 feet above sea level, what happens is there's a mechanism in the body where the red blood cell holds on to oxygen, and it doesn't release it as readily. And so we begin, the body without our permission, begins to breathe faster when we go to higher altitudes. And simply by that higher altitude, breathing faster translates into more fluid loss. And so keep that in mind when you travel or if you go to higher altitudes, that there's that risk of dehydration simply based on that mechanism. We don't think about people, for example, who breastfeed, losing fluid. You've got to replenish the body when you're breastfeeding, so that's important as well. Excessive alcohol and caffeine is also a risk factor for dehydration. And so, again, living in the desert, you've got to be very, very careful to replace the fluids when you're living in the desert, exposed to the heat, sweating, and really not recognizing that you're sweating, because oftentimes it evaporates before you even realize it. So those are some of the people who are at risk. In terms of my job as a medical physician and a hospitalist, we've seen patients, and I see patients very, very frequently come into the hospital who are dehydrated. And when I get a history, we find that, either they're a landscaper or they're a construction worker, and they're working long hours in the heat and oftentimes really can't catch up on the fluid. And when I asked them, they said, it's impossible for me to be dehydrated because I drink, 3 gallons of water a day. And the answer to that is that if you get behind the 8 ball, you can't really catch up. And boy, we've had patients come in who require dialysis because it's gone on for so long, and so long can mean only 2 or 3 days. It happens very, very, very quickly. So it's important to recognize what's happening in the body and stay ahead of the game. Fill your tank up. If you're going to exercise, we'll go over a few recommendations on what we would recommend that you do to keep yourself out of trouble of getting dehydrated. Now, what's the best fluid replacement? I get this question all the time. Is it water? Is it Gatorade? Is it, there's all different types of fluid replacements for the body. And I got to tell you that water, for the most part, is probably one of the best hydrating fluids, physiologically speaking. So, when we're dehydrated, toxins can build up in the body. They surround the cell. And if you're losing excess fluid through perspiration, or if you're sick, you're losing electrolytes, and you've got to replace that way. So water, number one, boosts energy. It reduces stress. It prevents cramping muscles. It even prevents wrinkles so that we look younger when we're hydrated. And if you just think about that, it really does make sense. However, when you're exercising or perspiring a lot, sometimes water's not enough. And we've got to supplement it with sodium and potassium. And I want to just take a moment and talk about salt, because that's really very important physiologically in the body. Wherever salt goes, water goes. And so the first thing that I want to say is that oftentimes salt tablets are taboo. We don't really recommend, from a health medical perspective, there's not too many times that we're going to recommend salt tablets. Even if you're a pro athlete in training, sometimes the salt tablet can do more damage than good. Why? Because it's difficult and it's almost impossible for the salt to get into the vasculature as quickly as it needs to get there. And so it's got to be kind of connected to a fluid. And so we've got to ingest it, not in a concentrated way such as a tablet, because what that can do is it can cause swelling in the brain. It can cause some really bad problems in the body. So we recommend electrolyte replacement. Pedialyte is a great replacement. The Smart Water is a great replacement. We're going to be talking about prickly pear in a moment here. And that's really also a great way to replace fluid, because what it does is it brings potassium and it brings sodium into the body. And basically what it does is it helps to kind of vasculature, increase the vasculature where fluid really is in the body. I tend to recommend avoiding a lot of the high sugar replacements like Gatorades and those kinds of things, because you don't really need all the calories that you're getting from that replacement fluid. It's better to go with a less sugar type of a fluid replacement. And just a tip that I find is really, really helpful. If you take just a natural fruit juice, and the prickly pear is one of those supplements, and you just mix it with water, 50-50, and then in a quart, if you take just a half a teaspoon of salt, if you take just like sea salt or something like that, what that does is it adds just enough sodium to replenish the body, and it makes for a really good replacement fluid, for the body. In people who exercise, just a tip, and this is real important, especially in the desert, if you're going out for a run or you're working outside, you've got to fill the tank before you exercise. And so just a thumbnail, something to think about, 2 hours before exercise, drink a bottle of water. That's 16 ounces of fluid. And then during exercise, every 30 minutes, the recommendation is to drink, 8 ounces of fluid every 30 minutes. And if you're exercising, profusely sweating in a high intensity way, every 30 minutes, the recommendation is to supplement with an electrolyte type fluid. And then after exercise, it's important to also hydrate, an hour after exercising with a bottle of water. So for me, that translates into about 3 bottles of water for an hour of exercise. 1 before, 1 after, and then during the exercise, you should be drinking fluid every 30 minutes to make sure that you're replenishing with some type of an electrolyte, supplementation. We've all heard of the 8-8 rule, 8 glasses of water a day. And that's basically just your baseline fluid. That takes care of the insensible fluid losses that we lose in the day. So that's important to keep in mind. But above and on top of that, we recommend hydrating with some additional. Now, I want to kind of turn our attention to something that we have in the studio. We're going to be talking about the prickly pear fruit and cactus a little bit later. But we have Natalie McGee is in the studio with us, and we're going to learn all about her and meet her in just a moment. Natalie, welcome. Thank you for being here.
Thank you for having me.
Before the show, we were talking, and you showed me a little experiment, and I want you to share it with our viewers now here.
All right. I want to show people, you oftentimes will buy a bottle of what is called purified water, and when you do, unfortunately, they've taken all the good guys and the bad guys out, and there's nothing left. There's no minerals, electrolytes, or anything. But prickly pear, if you put a teaspoon to a tablespoon of prickly pear in the bottle of water, you will end up getting your electrolytes balanced. Watch this demonstration. Watch the light bulb. I hope you can see it from there. If I put this probe in the water, nothing lights up on the light bulb. But if I put it in prickly pear, it lights it up.
That's interesting.
If you can see that, because water has absolutely nothing in it, but the prickly pear is full of magnesium, potassium, and all the wonderful minerals that you need to balance your electrolytes. So don't trust just a bottle of water. Be sure that you have it full of electrolytes, and a teaspoon of prickly pear in that water will take care of that.
That's great. That's great advice. And it really confirms what we were talking about in terms of fluid replacement. A lot of times, like you said, the water, everything is taken out of it. So we've got to replenish with the electrolyte. When we come back, we're going to focus on valley fever. This is something that's endemic to the Arizona area, to the San Joaquin Valley, California, New Mexico. It's a fungus. So don't go away. I want to talk about and tell you all about valley fever. We'll see you in a minute. Okay. Welcome back to Doc Talk Radio. This show is sponsored by Gilbert Hospital, Gilbert ER Hospital. It's the hospital with the helicopter on the roof on Power Road, and it really is, it was the first door to dock in 30 minutes, and really there's no ER wait. And so I want to thank Gilbert Hospital for sponsoring the Doc Talk radio show in this segment. Valley fever, what is it? Who gets it? Who's at risk? How do you treat it? What are the symptoms? Basically, valley fever is endemic to the desert. And what it is, it's a fungus. And it occurs when we breathe in fungal particles from the soil, from construction, farming, storms, windstorms, and all of that can possibly stir up the fungus. And when we breathe it in and inhale it, we become exposed to the fungus, and it develops what's called valley fever. I want to share with you a really interesting case. I had a patient a couple years ago come into the hospital, and she had been treated by her primary care doctor as an outpatient for pneumonia and was doing fine from a pneumonia standpoint, and then developed this really severe arthralgia, joint pain throughout her entire body. And then she developed a rash that was the type of rash that was very tender, very painful. And so because she couldn't move, she was just really debilitated from this arthritis. She was admitted into the hospital. Her doctor actually sent her in and was concerned about possibly, acute rheumatoid arthritis or some kind of an acute connective tissue disease. And basically, we diagnosed valley fever, which can present that way. It can present with severe joint pain, fever, night sweats. Sometimes a cough is present along with it. But a painful rash on the lower legs is something that is kind of a tip-off to diagnosing valley fever. Now, I trained back east, and a lot of times the physicians back in the eastern part of the country really have never seen valley fever. It's just a textbook kind of a thing. And so the message is for anybody who visits the desert, anybody that visits the area of Arizona, the San Joaquin Valley in California, New Mexico, this infection is endemic to the area. So it's possible if you're exposed to it and then, let's say, 14 days later, 30 days later, if you get sick, if you don't tell your doctor that you were recently traveling, then it could be a real diagnostic dilemma of making a diagnosis, because they really don't see coccidiomycosis is the fancy name for valley fever. So I don't know if we have, I have a video that I wanted to show so that you can see really what a dust storm. In Arizona, we have these dust storms. They're called haboobs, and when the dust storm hits, it really stirs up a lot of the soil. And you can see on the screen now what a dust storm looks like. This is a risk factor for valley fever. And, if you find yourself caught in one of these dust storms, it's really important that you try as hard as you possibly can to cover your nose, cover your mouth, and just try not to be exposed to the dust. Because what happens is the symptoms of valley fever can be anything from, like we said, fevers, night sweats, coughing. It can translate into pneumonia, and it can be very dangerous in terms of developing what's called a systemic infection in the body. Sometimes it could even cause meningitis. So, so you've got to be careful. Now, who's at risk for developing valley fever? Well, interestingly, people who live in Arizona and in the desert area, 50% of the people who live here are positive, have at some point developed this type of infection. And oftentimes, for the most part, it's more like a flu-like symptom. You get an upper respiratory cough, cold, it lasts a couple days, and then it goes away. And then you really never think anything of it. But sometimes people whose immune system is suppressed, for example, bad, uncontrolled diabetics, people who are on steroids for chronic use for chronic lung problems, people who have chronic heart problems, chemotherapy, anybody that has underlying chronic liver problems or kidney problems, cancer, anybody that has a diminished immune system is at risk for developing infection and what we call sequelae from valley fever, from being exposed to it. In particular, and for whatever reason, the research shows that, and we've actually seen that there are 3 groups of people that are at a higher risk of developing like a severe infection, so that if they get an infection, it can be more severe. In Native American population, in the African American population and also in Filipino patients. And we see that, and I'm not quite sure why that is. There's some hypotheses in terms of the structure of the nose and so forth. But it's interesting that those types of people, as well as people who are pregnant in the third trimester, if they become exposed to valley fever, it can become a very toxic and a very serious infection. So the complications of valley fever are pneumonia, meningitis. It can be the very chronic, debilitating arthritis that we see. But there's a treatment, and the treatment really is an antifungal type and antifungal medication. Oftentimes we use it by mouth. People who are more severe, we oftentimes recommend through IV use. So, you know, valley fever, we test it in different ways. And one way is to do a skin test. Valley fever is, what happens is when our body is exposed to it, our body develops antibodies against that infection. So a simple skin test is one way to see whether or not you've been exposed to it. And there are some studies showing that up to 70% of people who live in Arizona are skin positive, meaning that at some point we've been exposed to it, the body actually, you know, was exposed and then developed a reaction where the defense system kicked in, the immune system kicked in and basically cleared the infection. But the antibodies are still circulating in the body. So there's a skin test and then there's a blood test is how we make that diagnosis. So valley fever, coccidiomycosis, the take-home point is avoid as much as possible being caught in, you know, the storm and the dust storm in the desert, because that's how we inhale the spores that then produce this infection in the body. When we come back, we're going to focus on the sun. You know, living in the desert, the sun is prevalent. In fact, there's cities that have over 300 days of sunshine. We're going to talk about the health benefits of the sun in just a moment. Don't go away. Welcome back to Doc Talk Radio. You know, we were just talking about valley fever, and I want to address a couple questions that we were talking about just right here in the studio before we go on to the next segment. The question is, you know, people who are born in Arizona and live their whole entire life in the desert and really never experience the infection. And really, if we were to do a blood test to check the immunity, close to 90% of people that live and born and raised in the desert have been exposed to, had at one point in time just an upper respiratory infection, just with like a flu-like symptom, which probably was the valley fever. Your body developed antibodies to it, and basically then it went away. So you really never knew that you were exposed to it, but in fact, your body developed antibodies to it. And that's why a skin test is really the way to measure the antibody immunity. The other question that I think is really interesting to hear and to talk about is it possible, let's say for your mom who had maybe lived in the desert, had been exposed to valley fever, is it possible for that to translate down? And the answer is no. We've got to develop that immune response on our own. It's not something that is transferred from generation to generation. And I think that's a really, really great question. Well, let's talk about the sun, because the sun is something that is very prevalent in the desert. We know that there's over 300 days of sunshine in the desert. So oftentimes when we talk about the sun, the first thing we think about is melanoma, skin cancer risk. And the sun has really had a bad rap. You know, in and around the health community, talking about, you know, avoid the sun as much as possible because it can, you know, increase your risk of skin cancer. Today, I want to talk about the benefit of the sun, because clearly there's benefit that the sun brings to the body. When the body is exposed to the UVB rays from the sun, what happens is there's a reaction on our skin that allows the skin cells to convert and make vitamin D. And in fact, if you think about it, there's not too many foods that actually give us vitamin D supplement. You know, there's some, like salmon has vitamin D in it, tuna, but for the most part, we've got to ingest vitamin D as a supplement, and the other way that we get vitamin D is through sunshine. And so just to kind of give you an idea, just 10 minutes of casual exposure to the sun on our face, on our skin, allows the body to convert up to 10,000 international units of vitamin D in that 10-minute period of time. Now, that's a lot of vitamin D. And that's very important for the body to use because vitamin D is vital for healthy bones. There's a lot of research out now talking about vitamin D and the importance of vitamin D in the body. And I'll talk about some of that research in just a minute. But when you think about it, once we reach the age 50, there's a risk of osteoporosis. Calcium, because of estrogen changes and hormonal changes in the body, we need to bring in more calcium in the body. But vitamin D has got to be given with calcium. Let me give you an example, just something to kind of wrap your mind around so that it makes sense. Think about calcium as the building blocks and vitamin D as the gate that allows the blocks in and really the mortar that helps keep it in place. So without vitamin D, there's really not going to be a whole lot of calcium moving in and out of bone along with phosphorus. So if you're interested in healthy bones and you're interested in warding off your risk of hip fractures and osteoporosis and all of that, vitamin D has been found to be very, very important. A lot of research now looking at vitamin D in helping prevent cancer, autoimmune diseases. There's some really interesting studies looking at that, cardiovascular diseases. One interesting study that I want to kind of share with you has to do with multiple sclerosis. And there's some known research about multiple sclerosis showing that people who are born in May, for whatever reason, there's a higher correlation of people developing MS when they're born in May. And the question is, well, why is that? How can you really translate into, later in life developing multiple sclerosis if you're born in May? Well, recent research is now showing that there's a correlation between vitamin D and multiple sclerosis. And when you think about it, during the time of pregnancy and moms being exposed to the sun, they're finding now that there's some fetal, changes that are occurring at the cellular level that even at that time, in the fetus, the groundwork, the map is being laid in terms of genetics for later disease manifestations. So vitamin D is really, really vital and important. And so now we can maybe introduce some vitamin D supplementation in moms who are pregnant and so forth to maybe help ward this off. Other research looks at a model incorporating predicting vitamin D deficiency in time spent outdoors and in physical activity. Let me tell you what we mean by this. More than ever, now we are measuring vitamin D levels, and it's translating into a lot of cost. In fact, there's $30 billion being spent in testing vitamin D levels. Over the past 5 years, we've been doing this more and more. It's coming in vogue, if you will, because there's research now showing that there's benefit. Well, the question is, would it make sense to tailor and identify based on a risk stratification of people who, for example, are not spending time outdoors and who are not very active? Maybe that subpopulation of people might be at higher risk of developing vitamin D deficiency, and that's the people that we should do vitamin D levels on, versus doing it on everybody. For example, somebody that is very active, living in the Arizona area, being exposed to the sun with no significant side effects or history, family history and so forth, maybe those people don't need to be tested on a regular basis. So there's a matter of risk stratifying, and this is something that we'll be seeing more and more in the future, and it'll translate into cost savings. It'll translate into that which is being covered by the insurance as we move forward. Just today I got a beep on my pager. I get these interesting research studies that come out, and today there was a study that just came on a couple hours ago on my pager that said vitamin D is now being looked at to increase lifestyle, or actually people being able to live a healthier life who have Crohn's disease. And so now vitamin D is being tied to colon health. We know that there's some studies showing that vitamin D levels that are deficient may translate into risks for colon cancer. So vitamin D is really important. And how do we get it? Through the sun exposure predominantly. Now, supplementation is important, and the question is, well, how much should I take if I'm going to supplement with vitamin D? And the answer is anybody under age 50, 200 international units of vitamin D is recommended. Anybody between 50 and 70, 400 international units. and then over 70, 600 international units of vitamin D is recommended, in addition to the 10 minutes of casual exposure. Now, the question is it possible to overdose on vitamin D? And the answer is absolutely it is. More is not always better. Vitamin D happens to be one of those vitamins that is fat-soluble. Vitamin A, D, E, and K are the fat-soluble vitamins that we potentially can overdose on, and so more is not better. So you want to kind of stay in the range of, no more than 400 to 600 international units if you're going to take it, ingest it with a calcium supplement, for example, vitamin D with calcium. So the question is, being out in the sun, is it possible to overdose in, if you spend 24 hours out in the sun, is it possible that you're going to take in too much vitamin D? And the body is just an unbelievably made machine. And so the natural way that we make vitamin D in the body, it's a vitamin D3. It's impossible to overdose based on sun exposure from that standpoint. The message is only 10 minutes a day is needed. You've got to be careful with sun exposure, and I don't want to talk about the sun without really mentioning the risk of the sun as well. And just to kind of reiterate, there is a risk, clear risk of skin cancer when exposed to the sun. So you want to, kind of keep that balance. If you're constantly wearing sunscreen and not getting that casual exposure, you may be limiting the amount of sun that you're being exposed to. So, just on the arms, on the face, 10 minutes, walking back and forth to your car out in the sun is adequate enough to get the vitamin D transformation on the skin that we really need in order to make vitamin D. So, in a nutshell, living in the desert, learning how to stay healthy. The message is that there are things that we need to do to learn if we're going to live in the desert, because there's some risk to it. The risk is dehydration. The risk is, the dust that sometimes is, brought up in the soil that we can inhale and develop an infection, a fungal infection. And certainly the sun in and of itself can be a risk, but, there is some benefit to it as well. There's a lot of nutrients and a lot of nutrition in the plants of the desert. And, I can't wait to talk to our guests. We have an expert in the studio here. And when we come back, we're going to spend the rest of the time really talking about the health benefits of some of the desert plants, in particular, the prickly pear fruit and cactus. So you're not going to want to miss this. We'll be right back. Welcome back to Food Facts. Today we're going to talk about the prickly pear fruit. And we have a special guest with us in the studio. Natalie McGee is here from Arizona Cactus Ranch. Mm-hmm. Natalie, thank you so much for coming here and being with us today.
Thank you.
Tell us a little bit about yourself. I'd love to hear about your story and your background and how you got into this whole business of cactus. And
well, it ended up a complete mistake. Mm-hmm. I was a psychiatric social worker, and Charlie Manson was my easiest case.
Oh, wow.
And I was very busy in California, and then I got done doing the projects I wanted, which was getting sign language legalized and getting curbs and access for the handicapped and getting the ADA passed. And when I was all done, I moved back home to Arizona, where I live in a big cattle ranch where I was raised. And I was between jobs, and there was a little senior citizen community called Green Valley. And these little old folks down there, I thought, boy, I'll bet you they've never tried prickly pear. I was born and raised with it. And I thought, well, I think I'll just go down there. They're having a 3-day country fair. I'm going to go down there, and I'm going to introduce them to it.
Interesting.
And so I made this prickly pear, but I wanted to make it without sugar because we were always raised with it with sugar, and I didn't want the sugar. I didn't think the sugar was a good thing. So I went down there with these different wonderful little products for 3 days, and I didn't have labels on them, and everybody tried them and so forth. And the fair was over, and come Monday morning, my phone started to ring 22 years ago, and it has never stopped. And there's one thing you have to know about little old folks, and I guess we've trained them well. Mm-hmm. They knew 5 things. They knew their cholesterol, they knew their blood pressure, they knew their triglycerides, they knew their sugar, and they knew their Social Security number in that order.
Isn't that interesting?
And they knew this prickly pear had dropped their sugar levels. They were diabetic. They had gotten tests on their cholesterol. Their blood pressure was normal. And I said, well, I'm so glad you're feeling better, but I don't think it has anything to do with me. Oh, yes, it did, they said. And they knew better than I did. And at any rate, I thought, well, okay, but I don't think I have anything to do with it. They wanted more. Now, Green Valley folks, come winter, all go back to Wisconsin and Vermont, New Jersey, New York, wherever they're from, and they started telling all their friends. Pretty soon, I'm getting calls from all over the United States. We want this prickly pear. And I thought, I have no idea what this is all about. So I thought, well, I'll take it down to the medical center and have them check it out. So I took all this stack of letters and some prickly pear down to the medical center at the U of A and had them check this out.
That's where Dr. Weil is that right?
Yes, Dr. Weil also. He wasn't there at the time. His program wasn't until about year 2005.
Okay.
This was way back 22 years ago when I go down and I ask him to check this out. And I get this call back, and they agreed to check it out. And I get this call back from the medical center. My gosh, this product is so much better than the customers even know. Right. We're going to try and get a grant, and we're going to $70 million grant. We're going to crack the DNA code on this, and we're going to make a super duper pill. But you can't tell anybody where you got the plant from. Well, I felt it was God gave that to everybody, and everybody had a right to know that prickly pear would do these wonderful things. And I began to learn more about it. And then there's started to be a bunch of research that was being done at the U of A, where we found out if you took a teaspoon, a prickly pear actually was the size of a baby. If somebody took the prickly pear nectar, this is 100% pure concentrate, but if they take a teaspoon to a tablespoon a day, and I say teaspoon to a tablespoon, we're all different.
Right.
Not bigger people, bigger problems may need a little bit more. But if you took a teaspoon a day, your cholesterol will come down 20 to 40% in 2 weeks' time, and your good would go higher.
That's interesting. You know, the research that I've read about prickly pear is that clearly it decreases blood sugar. Yes. And in fact, you know, sometimes people have to be aware if they're on medication or insulin, their requirement for insulin is going to go down. Otherwise, their sugar is going to drop. Is that what you've seen?
Yes. In fact, I've been working with the Pasquayaki diabetic prevention program now for 18 years. We have absolutely turned diabetes around on that reservation. You can take a teaspoon to a tablespoon a day. And the Pasquayaki, they're large people with a very serious diabetic problem. They take a tablespoon a day, and it takes their sugar down 55 to 65% in 2 weeks' time, and they get very stable. They used to go up, down, but they get real stable, and it starts going down. If they're on insulin, they will be on 1/2 in 2 weeks.
And that's interesting to say. You know, a lot of times there's something called the metabolic syndrome, and the metabolic syndrome includes diabetes, truncal obesity, and a lot of, you know, this particular tribe has a high incidence of metabolic syndrome, being that this affects cholesterol and blood sugar. It's probably a really good supplement for them, and you're seeing that.
They give them a bottle at the reservations, and it has turned their sugar really around. Wow. We also found evidence that it's healing the pancreas. And a lot of times there's other medications they get on, it reduces the effectiveness of their pancreas, metformin, different types of medications like that. But if they get on the prickly pear, it starts to reverse that, and they get their 1AC test. In fact, I had a doctor just recently who wrote a letter in the chart of a customer who came down. He said, "My heavens, your sugar has enormously improved. What on earth are you doing? And she says, well, I'm taking prickly pear, Arizona Cactus Ranch prickly pear. It's a concentrate. And he said, this is the most remarkable thing. And as a result, through the years, I've had a number of doctors who are now prescribing it. I get more calls from people saying, my doctor told me to call you up. He has prescribed prickly pear for their blood pressure, their cholesterol, their sugar, their triglycerides. Right. And also cancer, which was a recent study that the University of Arizona has done. Mm-hmm. You also can get this information, all the research on this. And if you're not familiar with PubMed.org, www.pubmed.org, I'd like you to learn about that webpage. It's
Maybe
wonderful.
We can put that up on the screen in just a little bit so that our listeners can see that. What about, I've been reading a little bit about it in preparation for the show, in terms of, alcohol and people that, that drink alcohol and having that, problem the next day. Tell me about that.
This was a wonderful study. It was Tulane University, Leave It to New Orleans. New Orleans did if you took a tablespoon on their research, and before you drank alcohol, it would take and protect the liver from the toxicity of the alcohol, and you'd never have a hangover.
How about that?
And isn't that exciting? So I have a lot of people calling me up, particularly college kids. Right. And
if you look at WebMD, it really shows that the two things that prickly pear has been clearly and definitely found from a medical standpoint is diabetes and hangovers. And then there's a whole list of other things. Like you said, there's some studies about cancer and those kinds of things. Now,
and blood pressure?
Yeah, and blood pressure. Does it just come in the nectar, or can you give us a little, how does prickly pear, I know there's ice cream and there's all these different products.
There are, and I'm going to caution people to read your labels. There are several ways to make prickly pear. When they pick it off the field, most people put it in a pan of water and they swell it up and it becomes like a little peach, and then they squeeze it out, and what they really end up is colored water, but they call that prickly pear juice or nectar. There's another way to make it, which is the way I learned from the University of Arizona, Dr. Price and Karen Corman, Dr. Corman. And what I do is I take and put the prickly pear, I wash it, and I put it in my big, huge juicer, and it gets rid of the seeds, the skins, and the stickers, and gives me this thick pulp juice concentrate, and there's no water in here. And I also, when I cook it down, we lose about 20% water, so it's really a super concentrate product. That's why you only need a teaspoon to a tablespoon. Buyer beware. Almost all products are made, their first ingredient is either sugar or water. And you can get yourself into some problems with that. The prickly pear is good, but I'll tell you, for inflammation, pain, and swelling, if you have the product with all the sugar in it, you're going to keep that inflammation, pain, and swelling. And also on the cancer, this issue, because the U of A did that study. Mm-hmm. But if you take 100% pure prickly pear and learn to read labels, if you have products in there when you've got first water or first sugar or high fructose corn syrup.
Right.
Those are problems.
That's not good, exactly.
You're not good. You want to look for something that's a pure prickly pear.
And this is as pure as you can get.
That's as pure as you can get.
Right. Mm-hmm. We were talking, Ellie, about the cost. And can you kind of give our viewers just a little information, if you add this to the water and what it would cost?
This bottle, for example, has 96 servings. It's a 16-ounce bottle. If you took a teaspoon and you put it in this bottle of water, and I charged you $1, you'd end up paying me $96 for this bottle. That's what you pay for Coke, Gatorade, and water and all of the drinks.
Yes.
This is only $30. That makes it $60, $70 less than Coke, Gatorade, and water, and this will save you. I'm not sure what the others will do, but this will save you.
And, we were just talking about dehydration and replenishing for dehydration and the best replacement fluid. And you did an experiment, and I want to see that experiment again because, whether you live in the desert or you live wherever you live, dehydration is something that we've got to be cautious about. You know, let's say you come down with a gastroenteritis, and you know you have nausea and vomiting and diarrhea. You're losing electrolytes, and water sometimes is not the best. Although water is a great rehydrating fluid, oftentimes we need to rehydrate with electrolytes. And so I want you to tell us and show us again what that looks like in terms of the hydration.
Bottles of water. They're called purified water, and unfortunately they've taken all the good guys out along with the bad guys.
Right.
And so there's nothing left in this water, and if you watch this light bulb...
So the pesticides and everything is taken out
everything's
along with
gone.
The electrolytes that are really necessary.
Yes. Now, so when you put this probe in here, the light bulb won't light up because there's nothing in here. But if you put it in prickly pear, the light bulb really lights up, and the reason for it is because it's full of magnesium, potassium, all the minerals that will balance your electrolyte, where the water won't do a thing for you, but the prickly pear will save you. And, so that's the difference between water, Coke, Gatorade. If you get things with sugar in it, it also won't light up. Interesting enough, and I'm not sure I know quite why.
Yeah, I'm not sure, but I think that we know for sure that sugar is not healthy in terms of replenishing. In fact, there's some weight loss tips, and one of the tips is, you know, you don't want to drink sugary cold fluid during meals because it tends to affect metabolism, and so you know that may have something to do with it. Natalie, how do our viewers get in touch with you? If we wanted to order this, what is the best way to contact you?
Okay, I might also want to add the reason why I ended up making this product this way is I'm a social worker and I don't know anything about manufacturing, bottom lines, ripping people off. All I know is how to help people and care about them. And one of the things that these little old folks did when they called me from Green Valley after I did this 3-day little fair is that they said, and I called them up and I said, how do you want us to make this that would help you the best? And they said, don't put anything in it. And I've always honored that, and I always will. And I'm called Arizona Cactus Ranch, and you can either contact me by phone or I'm online. I have both a web page. The web page is www.arizonacactusranch.com, and everything is spelled out. It's a long E.
Right.
The other thing is you can call me either at 1-800-582-9903, or if your local number, which is area code 520-625-4419.
Right. And we'll make sure that I post that on our website as well, so that if there's questions or comments or people we can, make sure that they get in touch with you. Give us an idea of cost. Just this some of the bottles that you brought here. This is a concentrated, start with what you have.
This is got 192 servings. It's not $192. It's $175 less than Coke Gatorade. It's $50.
Right.
Let's see, that would make about $150. But it's $50 for this bottle. Then we have a 16-ounce, which is the next smallest one. There's 96 servings in here, and it's $30. Then we have a 12-ounce bottle.
Oh, the 12-ounce, okay.
And that's 72 servings, and it's $25. And then we have a little 4-ounce. A lot of people say, well, I want to try it. Maybe I won't like it, or maybe it won't work for me. And so a lot of people like to try it. And so I have a little 4-ounce bottle with 24 servings in it. And then after they try it and find how well it works, because you'll know in 2 weeks, they always call up and want the big one,
right? Because
it's the best buy.
Let me ask you, is there anybody that maybe shouldn't take prickly pear? Is there any danger?
There are, and I'll tell you, with people who are on dialysis, once you're on dialysis, the doctors recommend that you don't have bananas or anything with potassium in it. Right. Prickly pear, as the light bulb lights up, is full of potassium, magnesium. Those are a kind of thing that people who are on dialysis, they do not recommend that you have bananas or prickly pear because of the potassium levels.
Okay, good. And, for example, I always think about people on Coumadin I think this is safe. There shouldn't be a problem with vitamin K. This is more, the other electrolytes that you're talking about.
A lot of people have called up and said, is it safe? I'm on Coumadin. And the answer to that is yes. We haven't found any other counterindications that prickly pear hasn't worked very, very well with. A lot of people worry because they're on some kind of a statin and they can't have grapefruit juice.
Right.
They want to know, is prickly pear one of those problems? And the answer is absolutely not.
Okay, good. I'm looking through, we're going to be wrapping up here in a moment, but I'm looking through the different products that you have. And you have something called the Hangover Terminator.
Yeah.
Tell me about that. Is there anything else in that other than the prickly pear?
No, it's 100% pure prickly pear. The only thing is different is I put this little cutesy label on it that said Hangover Terminator, but it's exactly the same as the 100% pure
so
nectar.
it could theoretically, you can theoretically say, well, margaritas can be made with the prickly pear, and as you're drinking it, you're actually protecting yourself against the hangover effects of alcohol. Would that make sense?
That makes sense. And a lot of people are, and they're making beer and all kinds of things with the prickly pear. I also make a jam, and I call it guilt-free jam. It's the only jam I can think of that you can have it. It's no sugar in it. I put a little teeny bit of apple juice and prickly pear, but you can take little amounts of this. You'll get all these benefits from it as well. But also, I might add that the jam, how many jams can you get that you lower your cholesterol, blood pressure, triglycerides, sugar, weight, kill cancer cells, and enjoy?
Exactly. Not too many that I can think of.
And so I decided to call it guilt-free jam.
That's amazing. Now, do you ship all over the country? Or
I ship all over the world. Actually, I've gotten I've never advertised, but word of mouth keeps me busy. I've had people call me from Tel Aviv to Korea and I might tell a funny story if I had a minute. In my ingredient, I put one of the ingredients is love. And somebody from Korea had ordered a lot of prickly pear, and they called me from Seoul, Korea one night, and because they have to check all the ingredients in there, and I didn't know anything Korean, and his English wasn't too swift, and he wanted to know what love was doing in that bottle, and I was trying to explain to him. I did my best. I think he just gave up and just kind of said, well, that's Americans for you.
That's great. I want to thank you so much for being here. This has been very informative and really a great addition to our Doc Talk show. Yeah. What I'd like to do, I just want to give our viewers some information on how to get this. Again, it's Arizona Cactus Ranch. Email info@arizonacactusranch.com. And in a wrap up, you have a guest with you that we may want to invite over here just to take a couple minutes to kind of give us a testimonial. Charlie, do you mind coming and kind of joining in in the conversation? Okay. We're going to see if we can just kind of scoot over and maybe we can have you. There you go. That's great. Welcome to Doc Talk Radio. Thank you for being here.
Well, thank you.
I'd love to hear your story real quick. We have a few moments, and I know that this is something you have a personal testimony to it.
I'm a professional artist, and it's probably about 8 years ago. I was actually at one of the farmers markets in Green Valley, where she kind of started.
Right.
I met Natalie, and I told her that a number of years before I'd been diagnosed with type 2 diabetes. And it wasn't because I was overweight. It was just kind of an hereditary thing. My grandfather, my father, and then unfortunately the numbers came up for me. So I was asking her about this prickly pear, and she says, yeah, it could really do wonders for you. So I've been taking it for well over 8 years now. And it's pretty much, I watch my diet carefully. I exercise pretty much most days of the week, either bike riding or lifting weights or whatever.
Right.
And I've been taking a prickly pear, and it's really helped maintain my blood sugars. My triglycerides are below average, and my cholesterol is pretty low, pretty normal now. So
now, do you find any side effects? Does it cause any nausea? I mean, how do you tolerate it?
Not at all.
Okay.
I mean, I'm the one, I just poured in a shot glass and
just drink it right down.
Drink it down. I like the flavor. It's kind of like a strawberry watermelon flavor.
Okay, that's good to know. Wow.
So I highly recommend it.
And you drink it every day, is that right?
Yeah.
Okay.
Yeah. Yeah.
You know, I want to, again, thank you for being here. You know, we're going to wrap up. This has been a very interesting show. And you're pointing out, I want to just, this information that Natalie brought, as seen on Dr. Oz show. So there is some real validated information from Dr. Andrew Weil, the University of Arizona, you know, really validating prickly pear. Next show, we will have an acupuncturist actually here demonstrating and talking about the health benefits of acupuncture. You know, I'm a board-certified internal medicine physician, and it's amazing how we're talking about some of the additional modalities that we as medical professionals have got to look at. Nutrition, acupuncture, relaxation, all of these things are important. Until next time, I wish you health, wellness, and many blessings. Thank you.